Hi, it's Dr. Mike Pfeiffer. Nothing is more important to me than preserving the relationship our owners have with their pets. In short, it's more healthy years together. We achieve this by adhering to 4 principles in medicine: early detection, preventative care, oral health care, and weight management. I'm excited to introduce a new tool for us to help with our early detection, and it's called the Oral ID. This is an intense blue light, the wavelength approximately 435 to 460 nanometers, and when shown into tissue using a filtered glasses, the wavelength energy is absorbed and reflects back at a lower level energy. Healthy tissue will come back almost a light fluorescent green. Unhealthy tissues, whether they be trauma, precancerous, or cancerous changes, absorb more of the energy and will not reflect back and will actually look dark or black. Pigmented tissues cannot be evaluated, so that's important to know, because if we have a chow or a pet with a black spot in the mouth, that is not a problem. That's just a pigmented tissue and will not be effectively evaluated using the Oral ID. I want this to be used in any of our oral, anesthetic, dental procedures by technicians and assistants, and to shine it in their mouth. We're going to look at all the mucous membranes. We're going to look under the tongue. We're going to look at the soft palate. We're going to look as far back as the tonsils if possible. If there is an area of suspicion, we have a filter that we can apply to a cell phone, and we need to document that lesion or area of concern. We need to also bring it to the doctor's attention. Whoever is in charge of this dental needs to see it themselves with the light, with the glasses, the documentation with the pictures, and then it needs to be addressed with physical exam to see if there's any palpable changes. This is a very early detection, and this will actually pick up changes that occur before they're visible with examination white light, either room light or surgical lights. So this is an early detection tool that will help us identify one of the most deadly forms of cancer, and that's oral cancer. So many of our patients that are identified with that come in with an advanced case, and there isn't much that we can do. So this is, again, fits our model of early detection, and again, our goal, preserving that relationship, more healthy years together. Thank you.